Correctly identifying the nature of the alteration in an aggressive individual is crucial for a security guard in order to adopt appropriate containment measures. When a person is under the influence of alcohol, they often have alcohol-smelling breath, a noticeable lack of motor coordination, and a tendency to speak loudly or with difficulty. In contrast, drug use may manifest itself through dilated or constricted pupils, extremely erratic or apathetic behavior, and unusual physical reactions such as tremors or excessive sweating. Understanding these signals can help the guard decide whether to adopt a more persuasive and verbal approach, typically effective with individuals under the influence of alcohol, or a more physical and cautious intervention, often necessary when dealing with individuals under the influence of drugs. In any case, the safety of everyone involved must always be the priority. State of alcohol intoxication. Alcohol intoxication is characterized by a range of conspicuous signs that affect both motor and verbal behavior. Among the most identifiable symptoms are staggering and impaired balance, which result in awkward movements and may lead to accidental falls. The eyes frequently exhibit a shiny or red appearance, accompanied by heavy eyelids and the distinctive nystagmus, or rapid lateral movement of the eyeballs. Verbal communication becomes slurred, with difficulty in articulating words. The scent of alcohol is readily detectable on the breath, indicating recent consumption. Behaviorally, the individual may initially present as uninhibited and talkative. However, these traits can swiftly transition into euphoria, unprovoked aggression, and heightened emotional responses, often culminating in drowsiness or lethargy. Recognizing these signs is crucial, not only for the safety of the affected individual but also for the well-being of others. Pharmacologically induced modification. The characteristics of substances can differ significantly based on their classification, impacting both the physical and psychological effects on an individual. For instance, stimulants such as amphetamine typically enhance energy and concentration, whereas sedatives like alcohol and barbiturates produce contrasting effects, promoting relaxation and drowsiness. Psychedelics, including LSD and psilocybin, can profoundly transform sensory perception and consciousness, resulting in hallucinogenic visual and auditory experiences. Pharmacologically induced modification. Stimulants, cocaine, crack cocaine, amphetamines, physical. Significantly dilated pupils, mydriasis, excessive sweating, accelerated heartbeat, tremors, and involuntary muscle spasms. Behavior. Hyperactivity, intense agitation, rapid and erratic movements, focused and resolute aggression, paranoia, exceptionally swift reactions, and seemingly superhuman physical strength. The subject seems unable to remain still. Drug-induced modification. Depressants, opioids, heroin, methadone, sedatives, physical. Constricted pupils, significantly narrowed, markedly slow respiration, pale or cyanotic skin tone, entirely relaxed musculature. Behavior. Profound drowsiness, the nodding phase, during which the individual unexpectedly falls asleep, markedly slow responses to external stimuli, disorientation, and, if abruptly roused, confused and paranoid reactions. Drug-induced modification. Hallucinogens and cannabinoids, LSD, ketamine, high-strength marijuana. Physical. Red eyes, particularly due to cannabinoids, dilated pupils, and xerostomia. Behavior. Visual or auditory hallucinations, detachment from reality, unprovoked laughter, sudden panic, paranoia, and aggressive responses driven by unfounded fear. Individuals convinced they are being threatened by non-existent entities. Drug-induced modification. How to identify imminent threats regardless of the context. Indicators of an escalation in potential violence include clenched fists, tightened jaws, rigid neck and shoulders, and persistent rocking of the body. Gaze. A fixed gaze, fixation, or, conversely, eyes that persistently scan the surrounding environment, hypervigilance. Proxemics. Intrusion into the guard's personal space, an aggressive approach that disregards safety distances. Vocalizations. An abrupt elevation in vocal tone, shouting, growling, or a sudden transition to a menacing whisper. Drug-induced modification. Security and de-escalation protocols. Security personnel adhere to established protocols for managing these individuals. Drug-induced modification. Above, we observe the classic behavior to avoid maintaining a close distance. Distance and coverage. Always ensure a safe distance of at least 2 meters and avoid being surrounded or cornered against a wall. Drug-induced modification. Support call. Promptly notify the police and, if relevant, the operations center, supplying details regarding the individual's agitation. Drug-induced modification. Neutral communication. Employ a calm, assertive, and non-judgmental tone of voice. Refrain from sudden movements. Avoid prolonged eye contact with the subject, as this may be interpreted as confrontational, and do not initiate physical contact, as this could provoke unpredictable and violent reactions. Drug-induced modification. Isolation. If feasible, eliminate bystanders and confine the individual to a secure location, thereby preventing them from inflicting harm on themselves or others. Drug-induced modification. The management of individuals experiencing significant alterations is governed by corporate security protocols and necessitates adherence to the restrictions outlined in Ministerial Decree 269/2010 regarding the protection and safeguarding of assets entrusted to security institutions.